everyone, and welcome to our panel session on creating a culture of safety, harm reduction strategies for consumption of edibles among youth. We have three great panelists lined up for you during today's session. So our first speaker is going to be Dr. Kevin Osterhoudt. Dr. Chris Gaw will then follow, and then we'll finish off with Kristy Steele. Following the conclusion of the presentations, we will have a question and answer period. So if you have any questions throughout any of the three speakers' presentations, be sure to pop them into the chat, and we'll be sure to get through as many of those questions as we can. So it's my pleasure to hand it over to Dr. Osterhoudt.
Well, hi, I'm glad that we have this opportunity to get together and to talk about marijuana and THC a little bit. I am a pediatrician, a pediatric emergency physician, and a poison center director from Philadelphia. And for a long part of my career, marijuana was kind of the boring poison out there, but that's not true anymore. And fortunately, the University of Pennsylvania Museum gives me this nice courtyard that I can go to every April 20th and take my photo and ponder child injury due to marijuana. Next slide. So let me start by setting the context for this. Many of you will already be living the context, but for some of you who may not know how this story goes, I'm going to tell you a story about this 7-year-old girl. Her mother and father had both come home from work, were preparing dinner. She finished up her homework for the day. They sat at the table, and all of a sudden she started grabbing her head like something was wrong. And her mom was asking her what was bothering her, and she couldn't vocalize it. And then she started getting increasingly sleepy and she couldn't keep her head up. And her mom and her dad were really frightened. And so they called EMS, and EMS arrived. And, a little bit of a history. She hadn't had any fever or cold symptoms. She hadn't fallen. She doesn't take any medications. And they were certain there could be no possible drug ingestions. Next. When she got to the emergency department, she clearly wasn't acting right. Um, she was stuporous, and so she looked like she was asleep. And if you really yelled loudly or if you shook her, she could open her eyes just for a few seconds before falling off to sleep. They got some vital signs there. Her heart rate was beating a little bit fast, but otherwise looked okay. When they looked at her pupils, they were strangely more dilated than they were expecting them to be. And then she became hypopneic, which is our fancy medical word for she just wasn't breathing very well. She wasn't breathing enough. And so they placed her on BiPAP. That's kind of like CPAP. And it's a way to support her breathing and get some breaths in her while they figure out what's going on. Next. Now, for doctors taking care of a patient who suddenly has become unresponsive and isn't breathing well, they have a zillion things going through their mind. And a lot of times with our medical students and other trainees, we'll use this little vitamins mnemonic, but you might think about vascular events like stroke. Could she have had a bleed into her brain? We might think about bad infections like meningitis or encephalitis. We could think about trauma. Interestingly, here we have a lot of toxicants, and that's where THC or marijuana might fit. But this is a really unusual age, right? Epidemiologically, we see 1 and 2-year-olds who are curious and they're taking advantage of that pincher grasp and their newfound mobility, and they find things and they put them in their mouth because they don't know any better. And when you get to be 12 or 13 or 14 or 15, right, then we start to use drugs in kind of more intentional ways. But for 7-year-olds, it's really a pretty unusual time. So it wasn't jumping to the top of these doctors' heads. We think about metabolic problems like low blood sugar. We think about intestinal problems. We could even think about things like brain tumors or seizures, or sometimes you're really sleepy after a seizure. So all of these things are going on in these doctors' minds. Next. And so they started an evaluation, and the first thing they do is they check a blood sugar, make sure the blood sugar is okay, and that was normal. Then they decided, boy, we better take her right into a CT scan and make sure her brain's okay. And they did a CT scan, and the brain was okay. They did blood counts that were okay. There's a test called the venous blood gas, where you actually look to see how well are the lungs and the breathing mechanism working to keep the patient alert. And what they found was, boy, they were right. She wasn't breathing very well, and she was accumulating carbon dioxide and not breathing as well as they want. So they were glad they were supporting her breathing. And then because kids can sometimes get into ethanol around the house and sweet drinks and things, they did check her blood ethanol, and there was none there. Next. So that left him in a real quandary. And it wasn't until about 2 hours later that a urine drug test came back. And the urine drug test came back positive for 9-carboxy THC. That's the metabolite of THC or marijuana that we tend to detect in the urine. And the parents were shocked by that, right? How could their 7-year-old have gotten into THC? Even so, they didn't want to believe it, and it went through the process of getting it confirmed by a very fancy laboratory method that confirmed that there was definitely THC there. Next. So that became a real puzzle for the family, a real puzzle for the medical team taking care of the family, because the family said, there's nobody in our family that uses THC. We don't smoke it, we don't eat it, we don't have it anywhere. And then they started recounting the girl's day, and she had gone to school. She was picked up by her babysitter. They had stopped to get a snack in a grocery store around the corner on the way home, and then she came home. And it was only about 2 hours after coming home from coming home from school that she got sick. Next. And then they started to think about it, right? And they went into the grocery store. And when they were in the grocery store, the girl had asked for a crispy treat that she saw. And so the babysitter had bought it for her, gave it to her. She ate it when they went home. And that's when lights started to go off. And next. So this isn't the crispy treat that she ate, but it could have been. And where I live in Pennsylvania, there's a very famous shopping mall called the King of Prussia Mall. And I recently went into the King of Prussia Mall into a little store. And please know that in Pennsylvania, recreational marijuana is still illegal. And I bought this Rice Krispie treat, or actually you can see that it's a Lucky Charms treat. Looks delicious, right? As you look at it, you might notice that real Lucky Charms, the cereal I grew up with, is spelled with an S at the end, and this has a Z, so there's something a little funny. But it certainly looks like something any child would want to eat. And if you look down at the bottom corner of the front of that package, it says 500 milligrams. Doesn't say 500 milligrams of what? That's interesting. If you turn it around on the back, you see nutrition facts, but they aren't really nutrition facts. And now you start to see it has a little bit of edibles education. And it says to start with 1 serving. Doesn't tell you how much of a serving is. Up above it says to tear, share, and enjoy. But I know if I have a Rice Krispie treat, I'm not sharing it with you. I'm eating the whole thing myself, and I'm certainly certain that's the way this young girl was. And then if you look at the bottom, you might see that these little cannabis leaves. And so these edibles are out there and around, and children are getting into them in different ways all the time. Next. And we have so many stories, and I think Kristy can tell you stories, and Chris will be able to tell you stories, but we see kids getting into THC. One of the ones that I was involved with, we call it the Nerds Rope birthday party. A young preschool age child was having a birthday party. His mom brought over tablecloths and plates to give to set up the party. And when she opened her car trunk, she didn't know where they came from, but there was a box of these Nerds Rope candies. And so she said, "Oh, the kids will love these." And so she pulled them out and distributed one to every child at the party. Well, it turns out they were not real Nerds Rope candy, right? They were these counterfeits. And if you look over on the edge of it, you see it says 400 milligrams of THC per Nerds Rope. And so that party got to be a lot more fun, or maybe a lot less fun, depending on how you look at it, very quickly. Next. And these stories are happening every day. So yesterday, I just pulled one up from our poison centers chart, and here's a 3-year-old girl who went to daycare. At the daycare, they noticed that she was acting really lethargic and vomiting, and then they found out that she had eaten some of 25 milligram THC edibles. And we just see this day in, day out now, and it has become a large problem. Next. So we've been noticing this probably since 2014, and between 2014 and 2019 at my poison center, we've seen about a 500% increase in our child THC or child marijuana cases, and that increase was almost entirely attributable to these edible forms. And we talked about it in our injury research and prevention program. Next. And one of the big questions that we face is, all right, well, so what? Kids are getting into these. Does that make a big deal? And when I was younger, I remember everybody would tell me like marijuana is a good drug because you just can't overdose on marijuana. Well, it turns out that that's not true anymore. And Chris will tell you a little bit more about this in a few minutes. But when my colleague Colleen Bennett took a look at hospitalized children with THC exposures, she found that 15% were hospitalized in the ICU and 4% were put on ventilators. That's a remarkable number. But when we look, we can see that there is a common presentation for these young children. They often are stuporous or comatose. They often have big pupils, and they often have an increased heart rate. And the biggest dangers are really respiratory depression, not breathing as well as we'd like. And some of the children have movement disorders, and people that watch these children think that they look like they're having seizures. And this is a big deal. Next. My colleague Michael Tose from Boston Children's Hospital took a look at what type of resources are being used by hospitals when they evaluate these children with THC poisoning. And he showed that there's a lot of resources and a lot of healthcare expenditure being used. 65% or 2/3 are getting blood tests, almost a third are getting CT scans, and actually about 1 in 50 are actually getting a spinal tap test to try to figure out where this illness is coming from. And clearly, if we know the children have been poisoned by THC or marijuana, it makes this all a lot easier. So by getting families to give us the history, it's helpful. And we wonder if we had a quicker bedside test for THC, if it might modify this a little bit. Next. Most of my injury work in THC is with younger children, but it is important for us to realize that there are some issues with teenagers in THC, and we're seeing an increased number of ER visits from teenagers who are unresponsive or who are paranoid and even agitated or anxious. We're seeing teenagers come in with what they believe are seizures. We're seeing acute psychotic events, which isn't surprising maybe with acute large dose THC overdose, but we're also seeing these subacute psychosis events where teenagers who use very potent THC for short periods of time are ending up with weeks of psychosis before it resolves. We're seeing teenagers who have problems with vomiting that's hard to control, and certainly THC plays a big role in impaired decision making in so many risk behaviors for teenagers. Next. And there's a little bit that we've written on this hyperemesis or extra vomiting syndrome in THC if anybody's interested. Next. So we're asked to do a lot of advocacy, and I was really, really excited when the Trainees for Child Injury Prevention, a program with Nationwide Children's Hospital and the American Academy of Pediatrics, made Safe Edibles their day of action this past October 25th, 2023, and there was lots of social media and other great education that was put out there that was very helpful. I have written on this topic for healthychildren.org for the AAP. And when recently New Jersey legalized recreational marijuana, and the American Academy of Pediatrics chapter of New Jersey asked Chris Gaw and I to create some information for them about the implications for pediatric injury with that legalization. And we can share that with you if you'd like. But Chris has really become an expert in this area of injury prevention. So I'm excited at this moment to turn it over to my colleague, Chris Gaw at Nationwide Children's. And Chris, take it away.
All right. So thank you, Kevin, and thank you all for attending and listening on this very exciting and really changing topic. So Kevin talked a little bit about the clinical severity, these personal stories that we all have as pediatric emergency medicine providers or clinicians. And so I'm going to do a little bit of zooming out and looking at the big picture and the numbers and take you on a little whirlwind tour of what the literature looks like and what we're seeing and what trends are showing up. So we'll go to the next slide. And then just very briefly, we're talking about edibles containing THC, but just a reminder that the cannabis plant has over 400 compounds, and we are just beginning to start to characterize them and understand them. And so I think there's still a lot that we don't know, and there's going to be a lot that we're going to discover in the years to come when it comes to cannabis and edibles and marijuana. Next. And so first, I want to talk about the policy landscape. And so looking at potency on the next slide, we're starting to see that THC potency is increasing risk. And so this photo shows basically DEA confiscated plants, marijuana plants, looking at the average Delta 9 THC in those plants between 1995 and 2014. And basically, we're seeing that the potency, the percentage of THC in these plants has tripled over this time period. And obviously, this is a decade-old data, but we're seeing that trend that, at least in the unregulated market, that marijuana plants are becoming more potent with the psychoactive compound. And then on the next slide, we're also seeing that edible compounds, and this is the regulated market in many states, is also super potent. And so when we talk about what is a good THC dose to get you high or to get the effects that you want, it's really on that left-hand column, looking at doses in the 1 milligram range, 3 milligram range. And then if we want to highlight the macro dose, which is the 100 to 500 milligram range, that's actually what's contained in the packet. And that can be as small as 5 gummies, 10 gummies, depending on what the state limits are. And so we're seeing packages with what is considered macro doses of THC being marketed and sold in communities across America. Next. And we're seeing that policy changes are increasing availability. So back in 1996, we can highlight that California was the first state to legalize medical cannabis or marijuana. And then if we go to the next highlight, we can see that recreational marijuana started to pick up steam in the early 2010s with Washington and Colorado. And then you can see that states are starting to legalize both medical and recreational across the 2010s. I think there's a better way to illustrate this. And so on the next slide, you can kind of see the United States basically in a big box. And then as you can see, we're seeing a huge shift and trend towards legalization of medical and now recreational cannabis, kind of in 2 separate waves, both in the 2000s and then recreational in the 2010s. And so this is really increasing the availability of cannabis throughout our communities, both in a regulated marketplace and also by virtue of making it more available, allowing people to potentially grow cannabis. You're also seeing an unregulated marketplace also popping up in tandem. Next. And so how is this affecting our youth? So you heard a little bit from Kevin already about what we're seeing in both young children and older children. So I just wanted to focus on a little bit of data on how epidemiologically how it's affecting older youth. And if we go to the next slide, we can see that state data was starting to provide us an early warning. And so Colorado was one of the earlier states to legalize cannabis, and also was one of the earlier states to really put out data on what the implications from a policy perspective cannabis legalization had. And so this graph is showing Colorado Regional Poison Center exposures by age groups. And 2010 was when Colorado had legalized. And you can see where that red arrow is highlighting that this is the 9 to 17 year age groups. And you can see that there's a pretty steady trend of increase starting around 2010. And you can see that it actually affects all age groups as well. On the next slide, we are looking at a different state, but similar warning. This is in Massachusetts, and this is looking at Massachusetts Poison Center exposure data. And they broke it down into different types of cannabis, and they were looking at before medical marijuana legalization for a 4-year period, that was 2009 to 2012, and then after marijuana medical legalization from 2013 to 2016. And so the light blue bars are the after, the dark blue bars are before in terms of exposure calls and cases being called into the Massachusetts Poison Center. And you can see that among older children and adolescents, especially with edibles and cannabis plants, you can see that there's an increase in exposure calls. And then also you can note under edible preparations, there's a sudden jump in younger children, which we will get to. And so on the next slide, people have started to to try to really summarize all of this research that's coming out. And these study authors looked at over 6,000 studies to try to figure out is there an impact of cannabis legalization on cannabis use, and then also on health outcomes. And so based on their study criteria, they really focused on about 10 to 13 North American studies. And what they found was there appears to be mixed evidence, but a potential positive correlation between cannabis legality and cannabis use, specifically among populations that did not have access to cannabis before. And so they highlighted adolescents and older youth as one of those populations potentially being impacted by this legislation. They also noted, as Kevin has mentioned, that they're seeing additional outcomes or increases in outcomes such as cannabinoid hyperemesis and acute psychosis that seems to be correlated to legalization. So we'll go to the next slide here. Young children has been a huge buzz in both the media and in the academic literature about the impacts of cannabis edibles. And then on the next slide, we'll see that again, state data, and this is again Colorado data since they were one of the forerunners in this, showed that once you legalize cannabis, once it's in communities and it's available, that kids can get into them. And so the authors of this study looked at children ages 0 to 9. They were looking at unintentional marijuana exposures, so edibles and other types of cannabis. And you can see that starting after 2010, you start to see a steady increase in both poison center cases as well as hospital visits. And this is to Colorado Children's. On the next slide, this is showing some additional data that Kevin highlighted from Colleen Bennett's study in academic pediatrics, looking at Fizz data in 7 states and DC, and they saw a 13-fold increase in cannabis-related exposures among children less than 6. And again, you can see that that number in hospitalizations really increased starting in the 2010s. On the next slide, it breaks down what those characteristics were for those hospital encounters. And we can highlight that the mean age for these encounters was pretty young, so 2. So they limited it to less than 6, but the mean age was 2. And then again, 50%. So we'll highlight that 50% were inpatient admissions. And then again, 15% were ICU stays and 4% needed mechanical ventilation. So again, speaking to the severity of these exposures in a subset of these cases. And then we'll go to the next slide. And this study in pediatrics, which was published earlier this year, really demonstrates that exposure calls to poison centers are increasing nationally. And so from 2017 to 2021 for children less than 6 years of age, poison centers are getting at a 1,400% increase in the number of exposure calls to cannabis products. And then for the data that was available, they're seeing that a quarter or nearly a quarter of these exposure calls were admitted to hospitals, again, pointing to the potential proxy of severity. And so I just want to summarize this whirlwind tour on the next slide of, so we're seeing risk to children, and that comes through several kind of main factors. We're seeing legality increasing across the country. We're seeing potency of cannabis increasing across the country. The combination of legality is leading to accessibility to both children, caregivers, and it's really increasing the amount of cannabis that's available or just present in our communities. And I think there's also a level of acceptability. So a lot of the legal and policy pushes are ballot initiatives. So these are just basically what the people want, and people then vote these legislations in. And so we're seeing that we're finding cannabis is acceptable, which can be a challenge as well as we kind of brainstorm how do we protect children from harm. And with that, I will turn it over to Kristy.
Thank you, Kevin and Chris, for your great presentations. So I'm Kristy Steele. I'm the president and the founder of Save Our Families. As a leader in my community, one of my main focuses is providing harm reduction resources, education, and training to families and businesses in Northeast Ohio. Before I start, I want to thank everybody for joining us today, and I look forward to answering your questions at the end of our session. So today we're going to explore edible, next slide, please, excuse me. Today we're going to explore edible consumption through a harm reduction lens. I'll leave the medical jargons to the experts and the concerns about small children and to the safety experts. Today I want to connect with you from a different angle. For those less familiar with harm reduction, it's about approaching individuals with an open mind and meeting them where they're at. This means understanding their unique circumstances, be it homelessness, substance use, or mental health battles. With this awareness, we offer care and resources without judgment or restrictions. Whether we're caregivers, medical professionals, public service providers, friends, or family, excuse me. Sorry, I have bad anxiety, guys. Despite our good intentions, we must trust that, in a way, we know that people know what's best for themselves. Now let's turn our attention to the youth, particularly those choosing to consume edible cannabis products. I want to speak about teenagers. I don't want to worry about the young babies. I'm going to let the professionals handle that. Next slide, please. So let's talk about why do kids use drugs? Often those unfamiliar with substance use grapple with the idea of young people using drugs, but this is not a novel issue, just an evolving one. With cannabis increasingly becoming mainstream, access has become more accessible. Allow me to shed light on why some youth turn to cannabis. It's often a means to relax, quiet the mind, transform emotions from sadness or anger to joy, and it can alleviate crippling anxiety like this. Managing social engagements, and also being able to speak steady. So as you can tell, I didn't take my medication this morning. These insights aren't just theories. These are drawn from my personal journey, from youth to adulthood. Cannabis provided solace for various reasons. Next slide, please. So now let's pause for a moment and take a moment of reflection as I take a drink of water. I want you to think about the social pressures you felt as a teenager as you grew up. Feel free to share with us in the chat. I would love to hear. Now, some common stressors include school, friendship, romance, and family. That's a lot for a developing brain. It's crucial to acknowledge that not all families provide a supportive environment. Factoring in peer pressure, media influence, and various complexities, understanding these dynamics is vital as we navigate the evolving landscape. Next slide, please. Speaking of the pressures and complex family dynamics, let me share a piece of my, I thought we were on lived experience. Okay, thank you. Growing up, my mom grappled with mental health challenges and problematic substance use. As a youth, I struggled to comprehend both her mental health and mine. The weight became overwhelming, and I sought a way to cope with the drama of navigating life with a parent who faced bipolar disorder, anxiety, depression, and PSD. At the age of 13, I found myself shouldering responsibilities like caring for my grandmother, managing bills with her Social Security check, grocery shopping, daily chores, all while attending school for 8 hours a day. My journey with cannabis started at 14, shared with friends like me who navigated challenging home lives. Let me share a brief anecdote. I asked my grandmother for $8 3 days in a row. She inquired about the purpose of what this money was for. I asked her, I said, do you want the truth or a lie? She goes, you know, I want the truth. I said, I'm going to buy some weed, pack of cigars, and a gallon of iced tea. To my surprise, reached in her pocketbook, handed me $8 with a couple extra dollars to let me go and get her some snacks too. When I returned back home, she had a few rules for me. She decided to sit me down and have a talk. She told me I needed to smoke at home, I needed to focus on my education, and I needed to ensure that my friends were also safe, but most importantly, don't ever bring those police home with you. So these rules weren't unique. My grandmother had these same rules for her children. It created an open environment where we could discuss these matters without judgment. I wasn't made to feel inadequate. Instead, I was taught to be safe and responsible. Next slide, please. As we delve further into creating spaces for these conversations, it's crucial to recognize how stigmas erect barriers. Frequently, the language we employ inadvertently fosters reinforced stigmas. I actually want to address a few things we heard here today. They're loaded terms: poisoning and overdose. We've heard these words here. They are often sensationalized in the media as they trigger intense emotional responses. Given America's opioid-related overdose crisis, the term overdose has acquired a heavy stigma, often implying fatality. Applying this term to cannabis perpetuates the stigma around its use. Similarly, the term poisoning can be misapplied. While, as the doctors explained earlier, there are cases involving small children and cannabis edibles, there are instances where this term is inaccurately used. For example, if a teenager consumes an edible product and becomes sick, they go to the hospital, they deny that they used the product, but a test comes back stating they have THC in their system. That is going to be labeled as poison. But you have to take it and look at it. In a household that lacks a conducive environment for open conversations, children might refrain from the truth to shield themselves from repercussions, reinforcing barriers created by stigmas. Next slide, please. I want to encourage a vital discussion about cultivating and creating a culture of safety for individuals navigating the complexities of substance use. The stigmas around this issue have for far too long pushed people into isolation, burdened them with shame, and perpetuated feelings of inadequacy. It's time for us to collectively broaden our perspectives and move forward with empathy and understanding. Education is a foundational pillar for a culture of safety. To truly understand the challenges faced by those who use substances, we must educate ourselves. However, it's crucial that we seek information from non-biased sources like media journals that are, medical journals that focus on providing facts rather than opinions. Language shapes perceptions, and our words matter in our journey to create a safer culture. The term addict, junkie, and abuser can be harmful and perpetuate negative stereotypes. We must replace them with language that uplifts and supports the culture. Alternatively, we can use terms like substance use and substance user. Another key component to cultivating a culture of safety is the art of active listening. To truly understand, we must listen with open minds and compassion in our hearts. When someone shares their experience, practice non-judgmental listening. Set aside your preconceived notions and truly hear their story. Encourage dialogue by asking open-ended questions that invite individuals to share more about their perspectives and experiences. Acknowledge and validate the emotions expressed. These create safe spaces for open communication. Next slide, please. Most of us carry biases, some apparent and others implicit. While both can foster unintended prejudice, when unaware of these biases, we risk causing unintentional harm. Often, our perceptions are influenced by media portrayals, shaping how we view substance use. From sensational news reports depicting a crazed man on drugs to movies like Reefer Madness that narrate that drugs are dangerous, substance use has long been entwined with images of erratic behavior and criminality. It's crucial to recognize that biases are not inherently malicious, but products of societal conditioning. The media in particular has played a significant role in framing our perception of substance use. However, as we collectively evolve, we must reflect on these biases and acknowledge their existence and take steps to overcome them. Next slide, please. Now that we've explored the landscape of edible use amongst the youth, let's delve into the crucial topic of promoting responsible consumption. Ensuring the safety of all consumers extends beyond personal choices. It involves the responsible storage of edibles, especially in households with children. The allure of these products to young minds make proper storage paramount to prevent unintended access. Medical professionals highlight a significant concern: the risk of over-ingestion. The concern becomes particularly pronounced in the context of edibles where THC dosages lack standardized regulation, especially in private crafted products. This variability poses a genuine health risk, emphasizing the needs for clearer guidelines and awareness. As Chris brought up earlier in his presentation, there are macrodose and microdoses. And when you get into those macrodoses, things become a lot more dangerous, and that's where we need to make sure these children understand and these teenagers understand what they're taking. So determining a safe dose is a nuanced process. Studies consistently emphasize that person-to-person variability is driven by a difference in metabolism. Communicating this concept is essential, underlining that a suitable dose for one individual may not be suitable for another. For those new to cannabis consumption, understanding the hazards of overconsumption is critical. Symptoms such as heightened anxiety, dry mouth, and in several instances, nausea and vomiting should be communicated. This education is a cornerstone of responsible use, empowering consumers to make informed choices while cultivating an environment where cannabis is consumed safely and responsibly. Now, I understand that teaching the youth how to consume a cannabis product goes against everything we've been taught, but the reality is the youth are choosing to consume edibles, and we have a responsibility to protect them and promote safety over punishment. Next slide, please. As we acknowledge the inevitability that the youth may engage with edibles, our responsibility extends beyond mere education. It encompasses the creation of robust support systems. The cornerstone of support lies in fostering an environment of understanding and empathy. As I mentioned previously, encouraging open dialogue both at home and medical and educational settings is paramount. These conversations should be spaces where the youth feel safe to share their experience, express concerns, and without fear of judgment. Open communication channels facilitate a better understanding of the factors influencing their choices. Next slide, please. So I want to talk about some alternative coping mechanisms before we close out this presentation. As a meditation teacher, I often teach folks with mental health or problematic substance use how to meditate. The practice of meditation is a cornerstone in teaching alternative coping methods. This technique aids in slowing the mind, offering a moment of calmness while redirecting thoughts. Yoga is also another important practice. Beyond its physical benefits, yoga cultivates a harmonious relationship between the body and mind. The intentional combination of breath and movement promotes physical well-being and mental clarity. Encouraging creative outlets provides an avenue for self-expression, whether through art, music, or writing. These outlets offer individual means to externalize and process emotions, engaging with one's creative side. Also, incorporating social support networks is pivotal. Encouraging individuals to connect with friends, family, and support groups, ensure they have a network to lean on during challenging times. And one more thing, I just want to say, while we often can make these recommendations to people, some people may not be in the mental state to follow through. Sometimes we have to hold their hand, guide them through it, make the call, act as their advocate, and be there for them. So I want to thank you for your time today. Have a great day.
Awesome. Thank you so much, Kristy, and for the rest of the presenters as well. I think those talks were really informative of highlighting the extent of this growing public health issue, but then also highlighting some unique and innovative strategies that could be employed to really tackle this issue. So some good questions came through in the chat, and there was also a conversation around one of the cases that was presented and how the individual actually found the gummy worms in their trunk, and just really highlighting the importance of package regulation as well. But one question that came from Pam that I wanted to present to the speakers is, are you aware of any deaths due to exposure, and what, if any, repercussions caregiver faced due to those deaths? Did any of the speakers want to take that one on?
Yeah, sure. That's a terrific question, Pam. And so, and as Kristy mentioned, I think a lot of times toxicologists like me and injury prevention specialists and the public will often use these terms in different ways, and many of them can come with a lot of different stigma when we talk about poisoning and overdose and things. And so it becomes really important when we look at this to say, is it possible to die? And it's unbelievable how challenging that question has proven to be. What we know is there are a lot of people that use marijuana and THC products all the time, and the vast majority of them do it very safely and, as Kristy pointed out, many times productively. But in the situation of young children, I think what physicians have seen is that children definitely have discrete evidence of respiratory depression that they believe is life-threatening, that ends with these children being put on ventilators and being put into ICUs. There are varying reports on, with some authorities saying there are no reported deaths and other authorities saying there are lots of reported deaths. And it becomes really tricky because lots of people don't use THC in isolation. As Kristy pointed out, you could have THC show up on your urine drug screen, but it doesn't mean that anything that's happening with you right at that moment is due to THC. And so the biggest concern seems to be for people that have inherent heart conditions and maybe young children who really get mega doses of THC. And other than that, I don't have a great answer for you. And Chris, I don't know if you have anything you wanted to add to that or.
No, I think it's really challenging to know. And then there's also all the downstream effects of potential complications with putting a child through a lot of different intensive medical interventions. And so the term cause is really challenging, as Kevin alluded to.
So
Thanks.
I want to
Go ahead,
chime in
Kristy.
on that real quick. So I spent weeks researching this before I came and opposed these doctors with my point of view on harm reduction. And I heavily researched for the last 10 years, honestly, if anybody's ever died from strictly a THC related encounter. And there's no encounter. And any encounter where THC has been associated with a death, there's also been other intoxicants involved. Generally, things like opioids or cocaine are involved, and even alcohol, but there is not a death solely attributed to THC on record.
Awesome. Thanks very much for addressing that to our panelists. There's another question from Pam as well as, are you aware of any studies done on the impacts of CBD on children? She noted trying to use the new terms you spoke of, Kristy, but poisonings, use disorder wouldn't apply for a child who access a CBD edible accidentally.
Oh, you're absolutely correct. And that's why in the beginning of my presentation, I made sure to point out that I was speaking to the youth. So the youth is a broad age range. It can start between 13 to 24 years old. So when it comes to the young children, absolutely, the term poisoning is correct. They are unaware of what they are getting a hold of. But again, I'm addressing those who are able to identify the products that they are consuming.
Yeah, and I agree, Kristy. I often kind of speak out against the use of the term overdose because in order to be overdose, you have to have this concept of being dosed to begin with. So overdoses are things that happen in hospitals with medication errors or things like that. But for people who unwittingly get a medicine, they're not overdosing. And even if we went over to like the opioid epidemic, if somebody thinks that they're going to be taking a Xanax, but instead get fentanyl, that wasn't an overdose with fentanyl. That was fentanyl that they weren't meant to get to begin with. So.
Absolutely. That's an actual case of poisoning. Just to clarify why I'm here and I don't have a doctor on my name is because I actually lost my mom to a fentanyl overdose in 2017. So I'm very well versed with how all of that works for those who aren't aware.
Yeah.
No,
And Kristy, I think I heard you mention that you were going to oppose these doctors, and I don't actually think I heard you say a single thing that I disagreed with. So I think we're on the same team.
Just a little opposition on the language. That's the opposition. That's it.
Maybe. Yeah. All right.
I know we're running close to time, but just any final thoughts in terms of what could be done in terms of the regulations of packaging to prevent the unintentional exposure to CBD or cannabis among children?
I personally think they need to stop being made to be so pretty. As the good doctor showed earlier, some packaging, we already know that I'm a consumer. So here's some packaging that I've recently collected, like Rick and Morty. These things, they catch the children's eyes. They make them say, hey, what is that? That's bright, that's colorful. I know I'm 35 years old, and when I see pretty packaging, I'm like, hey, look at Rick and Morty. So just imagine what a small undeveloped brain is going to do. And if you take a little bit of a closer look at this package, there's absolutely no label. The only thing is on the back, but it doesn't say anything about a dosage. So these things need to be clarified and regulated. But also, here's the bigger thing. These are illegally printed. This is merchandise that is licensed. This is licensed merchandise that has been taken, has been modified, and then has been illegally printed. You can find these packages for sale on Amazon. There's no regulations behind them. And I think that is a problem, how accessible these packages are to those who aren't licensed to manufacture these products.
Yep, well said, Kristy. I agree with everything you said wholeheartedly. And it's actually interesting. I think that some states like Pennsylvania, where recreational marijuana is not available, it even increases that market for this kind of off-market products. And in states like Colorado and Oregon, they actually can look and say, all right, what we ought to do is figure out exactly how much dose is in a package or in a single unit size so that we don't have young children taking 500 milligrams of THC at one time. We should not be selling it in grocery stores next to where the legitimate candy and treats are being sold. We want to have it well marketed. And, Kristy, another kind of comparison I think about is in sex. And I think a lot of parents don't look at their 14-year-olds and hope that they're having sex. But if they are going to have sex, they want to have frank discussions with them and make sure they're doing it safely. And I agree with everything that you said about the use of drugs and especially marijuana, that, we can actually give that oversight and we can have communications and we can destigmatize it and we can make sure that it's done as safely as possible. And so I'm with you there.
And then just one final question came through is just if there's any efforts to regulate the marketing or advertisements. And I know Kristy mentioned it's really difficult to do when things are being sold online and produced illegally as well. Anything you're aware of? Mm-hmm.
Yeah, I think it's just the pace of these legislative initiatives and how they're being rolled out. And then it's also the patchwork of it. So it's marijuana still classified as a level 1 drug at the federal level, but then you have some states say that it's okay, some states say that it's not okay, some states say that X amount of milligrams in a package is okay, but how many? And so you're seeing that there are regulatory efforts, but because it's so confusing and so heterogeneous, that enforcement becomes an issue for everyone, and how to treat out-of-state packages if it goes from New Jersey to Pennsylvania or Pennsylvania to Ohio. And I think that's going to take some clarification and time and I think that potentially work at the federal level can be helpful if there's a more cohesive kind of umbrella to approach the regulation of these products.
Yeah, and one other question came in, but I know we're over time already, but it was just asking in terms of keeping these products out of reach in states that marijuana is legalized. If there's any work being done in that area that you're aware of?
I'm sorry, what was that question?
So they were asking, are there any regulations regarding keeping these products out of the reach of children where it is legally sold?
Right now, I don't think there's much regulation. I mean, we in Ohio just went from medical to recreational. That actually does not officially become legal for about another 10 days here. But currently, I can walk into the local dispensary a couple doors over and I can get access to unregulated products right now, and it's just everywhere, My history is I was once upon a time a street pharmacist as a teenager. And whether you're looking in a store or you're looking on a street corner, you're going to find these products. So while we're worried about the regulation of them, I'm more concerned about the education of them, because no matter if they're regulated or unregulated, they're still going to be getting a hold of. Because if you think about me starting my journey of smoking 21 years ago, there were not really any states that had already moved into the regulation or legalization process. So I think we have, as Chris said, we have a long journey ahead of us. These laws are going to evolve over the next few years. And there is discussions going on about reclassification. So maybe that will help with us to get some new laws and things to help, limit the access of these products. Like when you go to the store, cigarettes are behind a case. You can't just reach over and grab them. In my local gas station, the beers are in a certain cooler, and when you open it, an alarm goes off. So maybe things like that can be put in place to, so you don't have Rice Krispie treats sitting next to cannabis Rice Krispie treats and there's confusion. So hopefully those things will be passed and put in place.
Awesome. Well, I just wanted to say a huge thank you to our speakers for an informative session, as well as to the attendees of this session. There is now a break until 2:15 Central Time, 3:15 Eastern Time, and then you'll be able to find the closing keynote session on pediatric firearm-related injuries. But thank you again to our wonderful panelists, and I hope that you all enjoy the rest of the conference and have a great day.